Okay, the first step, as we already mentioned, is C. And what that refers to is actually you want to avoid the C posture, is what we refer to it as physical therapists. Now I'm going to put up some photos, some images, and in each one of those images you're going to see the common denominator is that that the same woman is actually in what you might call a slumped, slouched, or C posture. Her body, her back is actually forming the letter C. And you can see a woman, she's picking up a laundry basket and her back is in that C position. Even when she's getting out of bed, you can see that she gets up into almost like a sit-up position, and that again is putting her back in the C position. Bending over to pick up some keys, her back is rounded out like a C. Working at the computer, as she leans forward, she's having trouble reading the screen, her back forms a slight C. And also when she's making the bed, her back rounds out, slumps, forming the C. The last one is she's vacuuming, and which a lot of our patients have trouble with, and you can see there too she's in the rounded out C posture. Now you should be back seeing me again. As you want to see with the spine, and this is a normal human spine, and of course some things are missing right here. This is where your head would normally be. This is the pelvis. You can see part of the legs here. These are the little bumps that you can feel if you run your hand down the back of your spine. Now your back is actually designed to be the strongest when it's in this position. And that's a slight curve in, a curve out, and a curve in. So this spine would be like this, facing this direction. You can superimpose them too. When you start running into trouble is when you put the back into this position. And again, this is the C position. A rounded out, and what it does is it puts on stress on three different structures, or three sets of different structures, and that's what we're going to discuss right now. Okay, as we mentioned, we want to avoid the C posture because of its problematic effects on the spine. We're going to start off with how it affects the bones and joints. As I mentioned, this is the human spine, and we got bones that stack up to make your back, and in between it we have the discs. These bones are in the strongest position when they are in this slight curve in, slight curve out, slight curve in position. And the reason that is they're almost kind of locked into place. As you see, you maybe can't see, or maybe you can zoom in here. There's a lot of little joints here. These are each of these joints is almost like your knee joint. And right now the joint is together. As soon as we go like this, I don't know if you can focus maybe in right around in here, they start to come apart. And as soon as they come apart, they can twist and turn, which can cause pain, and they actually can kind of go out of place, which is can be problematic. To give you kind of an analogy of what that's like, I can fade back now, we got some Legos here. Now these Legos, when they're stacked up like this, they're nice and strong. So it's just, you can compare it to your back. When my back is straightened up, it's all locked into place, all the joints are set in. And if I lift like this and keep my back straight, we're nice and solid. Nothing's going to break this apart. It's very hard to hurt your back when you keep it straight. It's very hard to injure your back. But as soon as you bend it forward in that C position, see how all the joints start coming apart, and now things can happen. Now things can twist, now things can go out of place, go out of joint, and give you pain. So you really want to try to keep that back as straight as possible whenever you're doing all activities. I know it's impossible in some instances, but that's what you want to keep in mind. Keep it straight, so you keep your back straight so it won't break.
All right, thanks, Bob. My name is Brad Heineck. I'm also a physical therapist. I'm going to continue on from the C-shape aspect that Bob was talking about, and I'm going to get into detail what's going on with the discs between the vertebrae, so that you can actually see when you're slouched over in that C shape how it really abuses your discs and put them at a notable increased risk for injury. So let's carry on with that spine. All right, here we go. Not a bad catch, huh? Let's get back to work. No pun intended. Okay, here we go. Here's that C shape that Bob was talking about when we're hunched over. This is how my back looks when I'm picking over to bend up those keys if I'm not paying attention to my posture, as opposed to the nice curve in the back, particularly in the low back, is what I'm going to focus on, because that's where the majority of the disc injuries occur, is in the low back. Okay, healthy back, C-shaped back. Now again, what we're going to do, we're going to focus in, so I'd like to have the camera zoom right in to this red disc. Okay, if you look between each vertebra, the discs are all kind of a yellow shape, and this is red, and it's only red just so it brings out your attention to that disc, because there is literally an example of a herniated disc. Herniated discs are big red flag, a lot of pain, can change your life for a long time with pain and what you will not be able to do, so we want to avoid a disc herniation. Some people call it a slit disc. Technically it's a herniated disc, okay? So, how do we get these, or how do we prevent these, is what I want to talk about. We're going to put our back in that C-shaped position. Now, your back is in this position when you're bending over to pick something up with poor body mechanics, as well as when you sit in a chair and you slouch your bottom forward and you slouch comfortable in a nice, cushy, easy chair at home, or you're sitting on a firm back chair and you're slouched in it, or in your car seat. Very common to have a slouched C-shaped back when you're not even aware of it in the seated position. Okay, so we're in the C-shaped position, and we're going to look at the stresses going on in the disc so we can find out what's really going on and unlock some of the secrets here. All right. Now let's go right back to here. Here's disc, or vertebra number 4, number 5. That's how they're numbered, L4, L5, and we're going to look at the disc between L4 and L5. Now let's go down to our model, right to here. Here we have a vertebra coffee mug, so it's time to take a break. No, actually what we're going to do is look at this vertebra coffee mug as if it is a vertebra from that spine, the model of the spine. This is L5, this is going to be L4. And they stack up just like this, just like Bob had shown the disc, or how this thing stacked up with the toy model. Well, here we have a model of disc here, and we're going to put the disc between the vertebra, just like so. Now if you notice, this disc is soft, and that's actually how the disc is in your back. Your discs are not hard like a hockey puck. They actually have a tough outer wall, and inside there's fluid. And that is why you have mobility and flexibility in your spine, because each disc is flexible, because it has that fluid and that flexible, tough outer wall. Now when we bend forward in that C shape, this is what happens. Okay? Now, if you look at these bumps, these are the bumps that Bob talked about, and you can feel on the back side of your spine. And right through here is your nervous system, the spinal cord and peripheral nerves. Now, look what happens when you bend forward. The mechanics of this creates a wedge. And the wedge literally pushes the fluid in the disc backwards towards the spinal cord and the peripheral nerves. So every time you bend forward, it pushes a little bulge out towards your nerves. In a healthy back, that's not a concern. However, if you continue to lift improperly, you continue to sit with poor posture, month after month, year after year, the wall of the disc in the back side can be deteriorated and form a lesion, or what you just call as a weak spot. Okay? When that weak spot gets weaker and weaker, the bulge gets more and more. Over time, you get more pain, and finally one day, after the weak spot gets weak enough, we have this. Can you zoom right in on that as close as you can? Right here is a perfect example of a herniated disc. Note where it's bulging out, right into the nervous system, either the peripheral nerve or the spinal cord, which causes big problems. So we have to do everything we can to avoid that and get that back in as a therapist or a physician and then correct the problem. But the real trick is just to avoid having that happen. How do we prevent that? And that's what we're going to teach you. Back problems do not occur from bending over and lifting something one time. I bent over to lift up the 50-pound bag of rock salt for the water softener. Oh, that's when I hurt my back. I know it was. Well, I can tell you from years of experience of a therapist, as well as the continuing ed and all the things I've read, back injuries do not occur from one event. The back, the majority of the time, has already been injured over time from the times of you spent in this C posture. So, just imagine this stick represents your back. Standing tall, it's a nice straight back. When we bend forward, the back bends. When we come back up, it straightens up. When we sit with poor posture, it goes like this. Now, every time you bend over, it bends. Every time you sit with poor posture, it bends. This goes on Monday, Tuesday, January, February, month after month, year after year, and you continue to abuse that back. That disc gets worked and irritated and weaker, and finally, it gives out. Just like that. There's no doubt about it, it's from repetition. It didn't happen the first time I squeezed, but time after time after time, and bango, I got the backache. Oh, and the person's bent over when they walk into the clinic. They can't straighten out because that disc is pushed down the way. They got pain all over the place. That doesn't make sense. And we need to avoid that at all costs.